This is Andrew Kramer, Urology Associates, Cape Cod, bringing you a very, very unusual procedure. It's for male incontinence due to a prostatectomy, invariably. And this gentleman has had a failed sphincter already with urethral injury, and you're sort of doing a kind of last resort procedure. It's a sphincter, but a transcorporal cuff. The cuff goes through the corporal bodies, the erectile bodies there, that in his case is not of high concern to him. So I'm going to put the back end of the cuff behind it, in and out of the corporal bodies as the backboard to my cuff. So I don't have to get in that very tenuous space behind the urethra that was before injured. Now I can go with a wide swath of tissue behind it. But just to illustrate how tough this surgery is, you've got to find the urethra in this sort of conglomeration and mess of tissue, and we find it. It's not easy, but you got to kind of stick with what anatomy you know. And there's urethra. It doesn't look like typical. It's got a lot of fat attachments thing to it, but we know that's it. I've got it encircled there. It looks more urethral-like. And behind it, there, the corporal bodies. The erectile chambers where typically put the penile implant cylinders. Well, in this case, I'm just going to go into it and out of it. We're holding stitches like I always do. And when I do that, I'll have a window that I can enter with my cuff and go out with the cuff on the other side. Thus, there, when I cut into it, not a lot of blood in the corpora on the left or the right, but he's well into his 80s, so you don't expect a lot of blood. Plus, all those issues with the prostate cancer treatments have no doubt affected blood flow. But anyway, we are going to dissect. We get the holding stitches like we always do when we're doing penile implants, but in this case, we're going to go ahead and make our wide backing. There it is. So in and out of the corporal bodies called the tunica is that thick white backing to the urethra. This way, I will put in a cuff that encircles that backing as well and squeezes it, but I don't need to be in that very tenuous behind the urethral space that is stuck, no doubt. So, got the measuring device. I'm not going to show you all the steps, but there it's measured at 5 centimeters. That's typical when you are doing a transcorporal cuff because it's going to be wider than most cuffs would be in, say, a standard situation when you're just around the urethra. Once you add all that thickness to the corpora behind it, typically it is in the fives. So he now has that cuff, and I'm not going to show you all the putting together all the steps, but I will show you. I did a cystoscopy in the end, and it looks nice and tight. Not too tight, no risk of injury to the urethra, but nonetheless, there's my transcorporal cuff. Let me go to the cystoscopy, and there you go. You can see it. It's small, but on the screen, you see that tight little pucker. That's the effect of the sphincter cuff. I love how that looks right there. And like I said, is around the urethra, and it's going to be at rest for about a month. But yes, once that is done, there it is, tight urethra. That's activated, and he will be in good shape in about a month. Andrew Kramer, Urology Associates, Cape Cod. Thank you.